and YouTube, all those that are watching us all across the state of Mississippi. Again, good morning to everyone, wherever you are, watching us as we kick off open enrollment 2024 for the Affordable Care Act. Look, my name's Michael Miner. I am the Executive Director of Oak Hill Regional CDC, and one of our initiatives is Get Covered Mississippi. And we're glad to be with you again for the 11th time. We started in 2013, the first open enrollment. This marks our 11th open enrollment season and our 10th year of being so thankful to serve our fellow Mississippians and helping them to get affordable health coverage. We'll be having this telethon all day to bring you information about the Affordable Care Act, Obamacare, whatever you want to call it, the marketplace. It's an opportunity for you and your family to find out the options that you have available. We're excited to share with you. I started early today. I got in 8:30. I was just so excited about what we're going to do during this open enrollment season. I've already started a pre-telethon earlier today and reminding you again about our phone number, 662-298-3584, 662-298-3584. Or if you want to go to our website, getcoveredms.org, getcoveredms.org, download our app. We want to be able to work with you to get the information that you need. A lot of folks don't realize we cover the entire state of Mississippi. Let me say it again. We cover the entire state of Mississippi. Our headquarters, yes, is in the northern part of the state, Hernando, Mississippi. But we have navigators that are ready, willing, and able to assist you all across our state. Yes. So what can we help you with? That's one of the things people ask us. What can you help us with? Well, we have a continuum of options for you and your family for health coverage. It may be to go connect you in the marketplace where we have private companies that sell insurance, well, basically health insurance. The federal government has set this web portal up so we can connect consumers with these private health insurers. So you can review the plans and make a determination on what's the best coverage and the premiums and everything for you. And you may qualify for some assistance, the advanced premium tax credit, to make the coverage more affordable. I do want to remind you today that because of the new tax laws, you may have an opportunity to find even better premiums than you had before. We also can help you with the Medicaid and the Children's Health Insurance Program. We can help you with the application to get that done. We know the federal health emergency is over, and some people have lost coverage or about to lose coverage. We can work with you. We have some Medicaid application administrators that work you to get that done. Well, there may be some that the premiums don't work for you on the marketplace. You don't qualify for Medicaid and CHIP. But guess what we can do? We can connect you with one of our state's many federally qualified community health centers. We have a fabulous network. Yes, a fabulous network of federally qualified community health centers. Pretty much across the state, you're never more than 30 minutes from one of our federally qualified community health centers. So when you connect with us, one of our navigators, we have almost 70 navigators all across the state of Mississippi. So when we connect with you, we'll work with you to connect you with health coverage. And as I said previously this morning, we do encourage those people who do have health insurance to come and to utilize those services. My mom, she is covered by Medicare, and she has coverage through her retirement. She was driving about 40 minutes from our home for her checkups. Then when we opened up, helped the Aaron E. Henry open up the MJ Edwards location in Coldwater, Mississippi, she was able to stop traveling 40 minutes and take about a 10-minute drive there. She is really ecstatic, excited about the quality professional service that she receives. And it helps Aaron E. Henry because she has insurance, and that helps them as they try to work with those who don't have it. So we encourage those that you're there wherever across the state of Mississippi to work with our federally qualified community health centers, and they have quality coverage as well. Look, we want you to give us a call today, 662-298-3584. Again, 662-298-3584, or go to our website, getcoveredms.org. We want to be able to assist you. Now, we're going to be here throughout the open enrollment season. This is just the first day, just day one. And we will be with you through January 16th. January 16th is normally the 15th, but the 15th is a federal holiday, Dr. Martin Luther King Jr. Day. So we'll be finishing up on the 16th, but don't wait till the last minute. We'd love for you to get enrolled by December 15th. Yes, if you get enrolled by December 15th, your coverage could start as soon as January 1st. So don't procrastinate. As we should say back in school, procrastination, the newest sensation, rocking the nation. So we don't want you to procrastinate. We want you to come and be a part of this. Look, your family, friend, look, we all know, check it out now. We know some folks, maybe in our own home. We got some people that we know, beyond a shadow of doubt, they don't have coverage. Well, what you need to do is tell them to call 662-298-3584. I have an old friend from way back in high school that called me and said that their relative didn't have any coverage at all. Called me on Saturday. And I said, look, we're going to look into it. We're going to work with them and get it done. And it's so amazing to me that with all the publicity and coverage around, they didn't know about the opportunities that are available. So do not assume that they know about it. So again, 662-298-3584, 662-298-3584, getcoveredms.org, getcoveredms.org. We can work with you to help you get coverage. Again, the coverage is quality coverage. It's the doctor's visit, preventive services, the things that you need to keep you going. And so that you can not only have the quantity of life, but you can have the quality of life. We're excited on behalf of our board, our acting chair, Bettina Campbell, all of our board members of Oak Hill Regional CDC. We're so excited that we've been a part of this Get Covered Mississippi effort, the healthcare.gov, the Affordable Care Act, since 2013. Just celebrated 10 years, had a great celebration, and is what we're doing. And so we do this because we are feel so wonderful to help all of our fellow Mississippians. Yes, our fellow Mississippians to get coverage. And we want you to be a part of it today. So I want you to stay in contact with us. We have information on our website you can download. Our team has been working feverishly to make sure that we got the resources that you need and everything. Look, feel free that once we have stopped going live to get this information and share it with others so they can know about the opportunities, the things that we have. It never ceases to amaze me that even in this time when we are TikToking and we are on Facebook and Instagram and all this other stuff, that we still have people that don't have a clue about what's happening. So take an opportunity today, family, friends, anybody else, to connect them and let them know that it's open enrollment season all across the state of Mississippi. Some people may wonder, well, you said you're up in Hernando, but Hernando, Mississippi? Well, I'm not in Hernando. How can you assist me? And I'm down on the Gulf Coast. Well, let me let you know that we have an awesome statewide network. And I'm going to bring right up here on the screen where we have coverage. So you're down there in Gulfport and Biloxi, down the coast, and you say, y'all can't help me. I'm not going to drive all those hours up to DeSoto County. Well, guess what? If you're there in what we call Region 10, down in Gulfport and Biloxi, we have our great partners there that can work with you. We have both people, SOS, Jane and the crew are there, are ready to work with you. We have Mercy Housing and Human Development that are there, ready, willing, and to work with you all there. Gabby and the crew and the rest of them can help you. Give us a call at 662-298-3584. That is our statewide number, and we can connect you there with our team on the Gulf Coast. Well, if you're not so far as the Gulf Coast, maybe in the Macomb area, now we call in Region 1. We have our team down there, Braxton, Martha, Chastity, all of them down there. They're ready, willing, and able to work with you. Just give us a call at 662-298-3584. We can connect you with them. Of course, in Region 2, Metro Jackson area, we have Dr. Talley and the wonderful crew of our Get Covered Metro Jackson team there at Ferry Street that can work with you to make some things happen. Again, 662-298-3584. You can jump over to East Central Mississippi and our collaboration with the East Central Mississippi Regional Community Development Corporation, East Mississippi Baptist State Convention, the president, Pastor Ecclesiastes Goodwin, our team there that works out of Meridian, doing a great job. The Lewises, Sister Barbara Young, all up down there in East Central Mississippi, Meridian, all across that down the I-20 corridor. Give us a call, 662-298-3584. Maybe in Region 3, we have a great team. Our team, Mid-Delta Head Start, Washington County Opportunities, doing a great job there. Dr. Jacqueline Moore and the team, the Greenville area there, we can work with you, get it done. We're excited that because on Saturday, they're having a great big women's conference to talk about some things with women's health. You can call us at 662-298-3584 for more information. Go to our website, getcoveredms.org. Also, we can't leave out Bolivar County there. Yes, the greater Cleveland area there with Pastor Knox and Sister Knox and the Sister Hill and her sister and all of them. Look, they just would be excited if you gave them a call. I tell you, Sister Ethel Hill is one of the hardest working people we know. Sometimes she's walking, sometimes she's on a walker, she's got a cane. I don't know, but she is dedicated to going out there and making sure our fellow Mississippians are covered. You may be in Region 4. We have Aaron E. Henry has some locations there. We collaborate with them. Our team with Lakedra, yes, they're there, ready, willing, and able to work with you. You come up to Region 8, our awesome team there in the Golden Triangle. Brenda Smith Wilson, she's excited. She just gets so excited working with people to get things done. She's on the radio. She's at the library. They're ready to help you there in the Golden Triangle. If you go up a little further in the Tupelo area, Catch Kids, Carol Black and crew, they're there ready to assist you in getting things done. 662-298-3584, 662-298-3584. If you're up in Region 6, we have ICS Head Start Centers. Oh man, they just ready to go up. The Abigail, Tish, and the crew, they're ready to work with you to get coverage if you're there in Region 6. And of course, in Region 5, where our headquarters office is, we have all of those here. Sister Minnie Wilkinson's is there, and Sister Annie's Jefferson. You got folks here that are there, ready, willing, and able to assist you. So all over the state, wherever you are, we can connect with you. We can do it virtually. With Clarence Campbell, he has done an excellent job. We're during the pandemic where we're able to work with people virtually to get them covered, get things set up. So we have a team that we've gone through. We've had our workshop to kick things off. We're just excited. Look, I tell you, I told y'all, I was so excited when I got here at 8:30. I couldn't wait. I'd already done 20 minutes to let folks know what's going on. And I want you to get excited with me. Look, forget about everything else. You got family, you got friends, and they need coverage. You know they need coverage. They're not covered. Some of them think that the best thing they can do about taking care of their health is going up to the store and getting some Tylenol. No, let's work with them now. To get a call us 662-298-3584. Look, so we can get them covered. Your family, your friends, your frenemies, all of them, your church members. Look, we're going to be working on this open enrollment through January 16th. Look, give us a call. We'll make plans to come. And if you want us to do a workshop there at your community center or your church, we'll come. If it's on Sunday, well, I don't know, I might not can make a lot of Sunday mornings myself because I in my spare time, I'm also a pastor. But we have some other folks that we can send down there. We got Sister Pat Boga. She get in her neighborhood car and she'll go some places in between there and come in and will assist you in some of the things that we have happening. But we're here to serve you, our fellow Mississippians all across the state. We want to be able to help you. But somebody's saying, well, I am not in Mississippi. You can't help me. That's true. We can't directly help you, but guess what? We got the phone numbers, contact information. If you're in Tennessee, Alabama, Louisiana, Arkansas, we can connect you so that you can get coverage. Look, some of the stories real quick. I know I only got 5 more minutes. We have people who've come to us just devastated because they don't have any coverage, don't think they can get covered. And let me tell you something. Our dedicated Medicaid application administrators have worked with folks, some for several months, going through the application and getting it done. The family started with no hope, didn't think they would get covered, threw their hands up in the air, tears in the eyes, all that stuff. And let me tell you, once they got finished work with us, they had coverage. Was it easy? No. But we have a dedicated crew that worked with them tirelessly to make sure it was done. And they got covered. That's just, I wish I could go and tell you their name and where they're from, but we can't. Have to be careful about personal identifiable information. But I want you to know that family was literally shouting because they had coverage. Since it's our 10 years, I remember one of the first people that I enrolled was a couple. The husband had a great retirement, but the wife still had to work because she went in retirement. She needed coverage. He had bought a big motor home. He wanted to travel, and it was just killing him that he couldn't do it because she had to stay and work at Walmart. Well, I worked with him and got him covered in the plan, and she was able to go ahead and quit that job, and they would start traveling all across America. They weren't people that you said may come that low socioeconomic development. There wasn't a problem with the premium, but they needed coverage, and they were able to travel the country because they would connect with us and get coverage. We have all kinds of stories of people that we've worked with down through the years. We want you to be one of the success stories. We want you to be able to come with us and come and give us a call, 662-298-3584. That's 662-298-3584. Go to our website, getcoveredms.org, getcoveredms.org. You can download our app and get some information and whatnot. Go to our Instagram, our Facebook, our YouTube channel, wherever things at, we're there. And whatever, if you don't like Facebook, go to YouTube. If you don't like any of that stuff, 662-298-3584. And if you're just looking at us because you're looking over mama's shoulder, your auntie's shoulder, your wife or others, and you're seeing what we're doing, and you say, well, you know what? I got a friend at work that maybe you can help out. Well, guess what? Give them our number, 662-298-3584, 662-298-3584. Text about 5 or 6 folks today. So you heard that crazy man on the telethon today, Michael Miner, talking about going in and getting coverage. Well, get that number, text it to some folks, direct message them. Make sure the connection. Everybody across the state needs to hear this. All your church members, those in your sorority, your fraternity, in the lodge, you work at the grocery store there. Let them know. If you're there at the Walmart coming in, and you're the Walmart lady at the front, and you see some of your friends come in, look, that man told me to get you to call 662-298-3584 so you can get coverage. This is the day. This is the day, the big day, the kickoff for this open enrollment. We want you to be a part of it. We want to make history. We want to enroll more people than we ever have in the state of Mississippi. Look, my time is about rounding up on this section, but as you all can see, wherever you are across our great state, we are excited. We are excited on this first day of open enrollment for the Affordable Care Act. Come join us, be a part. Let's make history. Let's get excited. Let's do this thing. Let's make history. Let's do this thing. Let's make history. Oh, I'm repeating myself. But again, as we segue, I'm going to turn it right over to Duke here. 662-298-3584. 662-298-3584. One more time. 662-298-3584. That is the awesome number that can help get you connected with coverage. All right, Brother Duke, I'm going to switch it back over to you because I know we got another segment to start. Thank you. God bless you.
Good morning, everyone. Good morning. Such an amazing day. And we're going to turn it over to our CMS regional partners who are in Atlanta, Ms. Teresa Zayas and Ms. Tamika Miles.
Good morning. I'm excited. I'm telling you, this is contagious. And I learned in phone number 662-298-3584. That's the number that you need to call. So I want to share with you. First, I want to share with you that I visited Hernando. So if you have a chance to go and visit Hernando and get a tour of that great location and all their surrounding areas, please do. I really enjoy it. So, today is the first day of the Marketplace Open Enrollment. So this year, you're going to have an extra date. The end is supposed to be January 15. That's the end of Marketplace Open Enrollment. But because it falls on a holiday, CSIO, CMS leadership requested for that open enrollment to be extended one more day. So you have all day the 16th of January until 5 a.m. of January 17th to make your decision to enroll. And what is the best way to do that? Connect with Get Covered Mississippi. Why? Because they can help you navigate the system. Okay, they can help you be able to compare plans. And remember things to consider. Not only think about the cost, think about the network, think about the coverage, think about the distance that it will take you for you to go to your providers. So then there's subsidies. You might qualify for subsidies, and that can help you pay for your health insurance. So these are the folks here today that can help you out at 662-298-3584. So you already know you have an extra date. Because in a household, you have different family members with different age groups. Dr. Minor mentioned Medicaid. So we are going through Medicaid redetermination now. So if you have any issues going through that process, please reach out to Get Covered Mississippi. They can help you out. Like Dr. Minor said, this is not easy. And health insurance in general, not even under the Marketplace or Medicaid or Medicare, just in general health insurance, it's not an easy industry to understand. I have my private health insurance with the employer, and before I get anything done, I will call my health insurance to find out. Because like I said, it's not an easy industry to navigate. So, but you're lucky. You have the Mississippi navigators to help you out. And when you go to them, they will be so happy to walk you through the information that at the end you will feel comfortable in the decision that you're making, because you're making an informed decision. So if you have some seniors in your household, we already talked about Medicaid, okay, for children, pregnant women, people with disabilities, people also older than 65. But also, if you have some seniors in your household, remember that if you are in the Marketplace and you're getting subsidies, and suddenly you get a letter from CMS stating, it's time for you to enroll into Medicare. And when you get that letter, pay attention to that letter, because you have 30 days for that process. So then you need to go to the State Health Insurance Assistance Program. That's the SHIP. They can help you out with enrolling into Medicare. Of course, you enroll into Medicare through Social Security. Okay? So remember that. And it just happened that right now, Medicare open enrollment is happening. And the end of Medicare open enrollment is December the 7th. So like the same recommendations that I gave you, I gave also people with Medicare or that they need to enroll into Medicare. Please consider cost, but not only cost, the network, also the travel, your medications, your medical conditions. So you need to really have all the pieces of the puzzle together before you make that decision. So, but you're lucky, you have people to help you from both sides. When it, for all the M's, though those are Marketplace, Medicaid, and Medicare, by the way. So you have people to help you with all of them. So with Medicaid and the Marketplace, you have to call 662-298-3584 to get help. Also, don't get scared if you get a letter from the IRS. They're not coming to get you, okay? What it is that they are identifying people that have filed taxes without health insurance. So they're sending letters to those individuals, giving them information to, check and review and navigate the marketplace. So don't get scared. If you get a letter from the IRS, please open it. You have good information, but you're in the right place. If you're here today, you're in the right place because you are here connecting with the folks that can help you. And I'm going to pass the floor to my colleague, Tamika, that she has some updates for you. Go ahead, Tamika.
All right. Good morning, everyone, and happy open enrollment season. Thank you all so much for having us. We're very excited to join you all this morning. So I'm going to just highlight some new marketplace provisions for 2024. CMS will be implementing a bronze to silver crosswalk policy in marketplaces on the federal platform for 2024. So this means that an enrollee who is currently eligible for cost sharing reductions and is currently enrolled in a bronze level qualified health plan and who would otherwise be re-enrolled in that bronze level health plan, they're now eligible to be automatically re-enrolled in a silver level qualified health plan. So it would have to be the same product with the same provider network and with the premium that is lower or equal to the premium of the bronze level plan. So for enrollees whose current qualified health plan or product will no longer be available in the coming year, CMS is amending the marketplace re-enrollment rules to require all marketplaces to incorporate network similarity into the auto re-enrollment criteria. CMS has finalized a policy to allow assisters to conduct direct door-to-door enrollment assistance. Assisters are currently prohibited from providing enrollment assistance upon an initial interaction at a consumer's residence. The goal of this policy is to increase consumer engagement and advance health equity by eliminating access barriers for consumers to receive timely enrollment assistance. CMS has finalized allowing HHS an additional 15 calendar days or a total of 45 calendar days to review evidence submitted by agents, brokers, or web brokers to review allegations that led to the suspension of their marketplace agreements and to provide notification of HHS's determination. HHS has an additional 30 days or up to 60 calendar days to review reconsideration requests and to notify the submitting agent, broker, or web broker of HHS's reconsideration decision. So these extensions are beneficial because they allow more time in the review process to review complex technical information and data. They can revisit consumer complaints and to conduct outreach to consumers. CMS also finalized a requirement that agents, brokers, and web brokers document that eligibility application information has been reviewed by and confirmed to be accurate by the consumer prior to the application submission. So this requirement will help with enforcement activities and help expedite the review of consumer complaints related to incorrect information on their eligibility applications. CMS has finalized the requirement that this documentation be retained by the agent, broker, or web broker for a minimum of 10 years and be produced upon request in response to monitoring, audits, and enforcement activities. In addition, CMS has finalized an agreement that agents, brokers, or web brokers must keep documentation of consent from the consumer prior to providing assistance. So this requirement will help with enforcement and help resolve disputes between enrolling entities and consumers. This documentation must be retained by the agent, broker, or web broker for a minimum of 10 years and be produced upon request. And I have a quick little update on the No Surprises Act. The No Surprises Act protects insured people from receiving surprise medical bills when they receive most emergency services and non-emergency services from out-of-network providers that are in-network facilities. So it also establishes an independent dispute resolution process, or a IDR process, for payment disputes between plans and providers, and provides new dispute resolution opportunities for uninsured or self-pay individuals when they receive a medical bill that is substantially greater than the good faith estimate they received from the provider. On October 27th, 2023, HHS proposed a rule that addresses specific issues critical to improving the functioning of the federal IDR process. So if finalized, this rule aims to improve communications between payers, providers, and certified IDR entities. The rule will adjust federal IDR timelines. It will establish new batching criteria, create a more efficient federal IDR process, and change the administrative fee structure to improve accessibility to the process. So to read more on this proposed rule and or to submit a dispute, please visit cms.gov/no surprises.
So we hope that this information has been beneficial to you, and we're here to support your local efforts. But the most important message of today is, remember, open enrollment starts today. If you want your coverage to be effective on January 1st, then you need to enroll by December the 15th. If not, you have until 5 a.m. January the 17th to enroll. Thank you so much for having us, and let us know how we can help in your local efforts.
I think I need health insurance. Where can I go to get insured? Who can help me get covered? Is it too late? Can someone help me? Come on in. Let's get you covered. Can you help me get insured? What do I need to bring? Can my family get covered? Yes, I can help you. Bring income info, SS number, and household dependent info. Let's set you up. If you need help also, give us a call at 662-983-584.
Once again, good morning, everyone. So good to see everyone on here this morning. And I guess it's on me to do the from headquarters. Thanks our regional partners, Teresa and Tamika, for playing a part in this telethon. So we are here every day, Monday through Friday, and it's about appointment on Saturday. Monday time is 9 to 5. Tuesday time is 9 to 5. Wednesday time is 9 to 7. Thursday is 9 to 7. And Friday is 9 to 5. And of course, Saturday by appointment. We are here located at 1775 Memphis Street, Hernando, Mississippi. Again, you can call us. The number that's been repeated all day, all morning, 662-298-3584. You should have that embedded in your brain now. I think I have two devices, so I want to switch over and go to, see if I can find my other one on here. Okay. So I'm walking through the headquarters now. I'm going to introduce one part of our headquarters. Miss Minnie she's shocked right now, but I had to. Sorry, Miss Minnie, I had to put you on the spot.
Yeah, we gotta get covered. Going back to our big headquarters. We're ready. Our signs up, ready to go out here. The jumpy kids, ready to get up. We got our get covered. Come on, do what's up.
I'll be back there soon. I just had to introduce Miss Minnie. Tell the people, hey, Miss Minnie.
Hey, everybody.
How long have you been working with us, Miss Minnie?
10 years.
What's something that you enjoy about being a part of Get Covered Mississippi?
Being part of Mississippi is working with the people, helping them, doing things, helping them with get the helping them with the get what they need, and talking with them, finding out what they need for their needs in order to get the insurance and different stuff like that.
Are you excited for this open enrollment, Ms. Minnie?
Well, yes. Yeah, it's kind of surprised though, but yeah, excited.
All right, thank you for that, Ms. Minnie. And Ms. Minnie is at the headquarters office on Mondays and Wednesdays and Fridays. Can't forget about Fridays. So yes, we're just walking through the entire headquarters, trying to make it back here to Pastor Minor. And he's here, right here.
Hey, we're here. Hey, we can get on more than one way.
Also have Miss Philistine Albright. You want to tell the people, hey?
Hey, everybody.
So it's gonna be rock and roll again at 2:00 today.
Yes, she will be here at 2:00. 2:40. Yeah.
It's our headquarters location, and I'm just excited because we got our signs up here in the back that really match everything to look. I get covered, our overall organization, help the kids, we get everything we can do. Back here. You like, I guess I should turn the camera around, show them our training area. Our training area, we actually have this big space. We train our team members. As you can see, we got all kinds of signs. And when we get ready to train, we have tables and chairs set up. I guess you know what's gonna happen? Saturday, we got our Women's Health Day.
Yes.
Space. We transform them out.
The Women's Health Day, yeah, starts at 9 and goes into 2.
Oh yeah, all kinds of things, women's health. It's an awesome thing. So this is it. We want to show you. We still got some slots left too.
Yes, still have slots. Please contact the importer dog 298-3584 if you would like to be a vendor for that event and just come out. And I believe it's open to the entire community.
Yes, time for it. All Orlando, Cockle, South Haven, Corn Lake, Stockholm, you know.
And not just for women, right? Even though it's a women's health.
Yeah. Y'all can come, but it's heavily part of that kickoff week. The NFL has this kickoff week. Well, Oak Hill and get our kickoff week too.
Show our signs.
Yeah, that's fine.
He said he didn't drink coffee, but he's excited today.
All right, next thing.
Okay, I am back in the office. Of course, if you have any questions, please drop them in the chat. And to the ones who are on our social media, drop them in the comment section. We have people looking. So if you have any questions about open enrollment or how we can get you to a nearby navigator, just drop your zip code in the chat or in the comment section on our YouTube and as well as on Facebook. Everybody on Zoom, I just want you to take time out right now to go on our Get Covered Mississippi Facebook page and share it. And tell everybody to tune in because today is the first day of open enrollment. Take 2 minutes out your time right now to go to Get Covered Mississippi and share it. We want to run up the views, especially to the people in the state of Mississippi. While you guys are sharing those views on our Facebook, we also wanted to announce we celebrated 10 years this year. We will have more. We will talk more about that. But Get Covered Mississippi is 10 years old, so let's everybody just give it an applause. And I'm going to share a video that we did for.
Ladies and gentlemen, distinguished guests and fellow Mississippians, welcome to a momentous occasion. the 10-year anniversary celebration of Get Covered Mississippi. We are here to commemorate a decade of dedication, passion, and unwavering commitment to promoting health coverage options and wellness across our great state. Get Covered Mississippi is not just an organization. It's a movement that has transformed lives and communities. Through its faith-based coalition, it has raised public awareness about health coverage options available through the Affordable Care Act, Medicaid CHIP, Medicare, and our federally qualified community health centers. The dream of a healthier Mississippi has driven us for a decade, and today we celebrate the milestones we've achieved. From the beginning, our goal has been clear: to see Mississippi emerge as one of the healthiest, most insured states in the nation. Our organization's heart lies in connecting with individuals and families, empowering them to make informed choices for their health coverage. We've championed healthier lifestyles and worked tirelessly to nurture healthier communities, and we are proud of our accomplishments. Our threefold goals have guided us along this journey. First, we rallied grassroots efforts to create healthier communities that benefit everyone. Second, we provided Mississippians with the right resources and information to navigate health coverage options. And third, we have continuously supported our people in making healthier food choices and staying active. Each region of Get Covered Mississippi plays a crucial role in our success, reaching out to individuals across the state. The collaborative spirit among these regions has been the driving force behind our accomplishments. We believe in giving you the confidence to make the best decisions for your health insurance plans. As we celebrate today, let us not forget the work we've done to help those who may not qualify for subsidies or Medicaid. Our collaboration with federally qualified community health centers has ensured that all Mississippians find a medical home, regardless of their circumstances. Referrals to these centers have made a difference in countless lives. This celebration is not just about looking back, it's about looking forward. Our vision for Mississippi's future remains vibrant and clear. As we move ahead, we pledge to continue our outreach, education, and inspiration with the same fervor that has defined us for the past decade. So let's raise our glasses to Get Covered Mississippi's 10 years of impact, advocacy, and service. May our journey ahead be just as fulfilling and transformative. Thank you all for being part of this remarkable occasion. And now, let's enjoy the evening's festivities, celebrate our achievements, and embrace the vision of a healthier Mississippi for all.
Such an honor to be a part of this great organization that has been helping the state of Mississippi get covered through the Affordable Care Act or Medicaid and CHIP, or referring them to the federally qualified community health centers. Now it is time. We've heard from the headquarters office all morning. You've heard from our CMS partners, and now it's time to turn it over to some of our navigators. Our first navigator that will be participating is Dr. Henry Knox and First Lady Knox. They are in the Delta, and I believe they are coming live from Mound Bayou this morning. So, Pastor Knox, are you with us?
Do.
Yes,
So
ma'am.
I'm trying to turn it around. So we are here with the Delta Health Center.
All right. Well, you're more than welcome to share.
Screensaver on. Thank you.
Hey, Ms. Knox, if you go to your settings, your video settings, and turn that background off. There we go. Now you can cut your mic on and y'all can take it away.
And we're gonna let whoever.
Southern Health Center this morning with Reverend Mrs. Knox, welcoming them as we kick off open enrollment for the healthcare marketplace. We have 6 weeks, November 1st to December 15th. If you do not have health insurance, we have some plans for you. They're very affordable, and we want to talk with you. Ms. Knox?
Good morning, good morning. We will be at Delta Health Center. We will be taking referrals from the receptionist. Anytime anybody come in without any kind of insurance, health insurance, they will be referred to us. We will be on site at different sites. On Mondays, we will be here in Mount Bayou. On Tuesday, we will be in Leland. On Thursday, we will be in the North. Anytime there's a referral, we will be here to accept referrals and do the application on site. If you have any question at any time, please get in touch with your receptionist here at the center, and she will in turn call us, although we will be on site.
And the number to call, Michelle?
662-543-0162.
662-543-0162. Well, we think you will be surprised. We have very affordable policies that are available. We want to help you get insured, get health care.
Also, if you don't have you're not qualified for Medicaid, then we will refer you to one of the federally qualified health centers. We will be also doing marketplace insurance, CHIPS, and Medicaid at during this time. So we plan to cover you in any way that you need insurance to get covered or to see the doctor. There's no reason for you not seeing the doctor and get the help that you need. Follow up on all referrals and get your checkup.
And here at Delta Health Center, we will see you regardless of your ability to pay. So come on in. We have offer primary care as well as pediatrics, women's health care. We have physical therapy, dental services, and behavioral health services. So come on in and make an appointment today. Come in and see one of our providers.
Thank you so much. Thank you. Thank you. Mr. Duke.
Yes, ma'am.
Do you need something else?
Sure.
Good morning, everyone. My name is Tamika Simmons. I serve as the Public Relations Director at Delta Health Center. And just to give you some background about Delta Health Center, right now we're standing in the lobby of our Jack Geiger Center, which is located in Mound Bayou, Mississippi. Jack Geiger is one of our founders and was critical in the start of the healthcare movement along with Robert Smith. And because of the work and the vision that they had, we have federally qualified health centers, not only Delta Health Center, which is located here in Mound Bayou, but also the other 17 locations that we have within our network. And then, of course, there are more than 14,000 federally qualified health centers across the nation, all in every congressional district of the United States. And each of these federally qualified health centers offer medical services, primary care, regardless of an individual's ability to pay. This type of medical model in serving people who otherwise may not have access to medical care grew out of Freedom Summer, and it grew out of the 1960s and the movement to make sure there was equity across healthcare in the United States of America. So we're just excited to be a part of this activity, and then of course to make sure that people are enrolled and that their coverage is comprehensive, that there is something that fits for them right now in this point of life. We know that life and circumstances change. Sometimes there are extensions to family members, sometimes health circumstances change. And so you want to make sure that every year during open enrollment, that your plan fits your current situation. And that's what our partners and Dr. and Mrs. Knox are here to be able to assist individuals with. Feel free to reach out. Our team has already shared our contact information. Feel free to reach out, contact us. We're here to support. And of course, open enrollment goes for several weeks and it starts today. So don't put it off. You want to make sure that you're enrolled. You want to make sure that you speak with someone. The Knox family has been fantastic. They've worked with Delta Health Center for years to help us to do this type of work. And so again, we thank each of you for tuning in, and we thank you for allowing us to be a part of this.
Thank you, Dr. Simmons. Very informative. Thank you, Duke. Thank you, Duke. If you have any question, feel free to contact us. If not, contact us. Contact Oak Hill Regional CDC at the main office in Hernando, Mississippi. That being all, Mr. Duke, Mr. Knox, if you would have something to say.
No, great job. Appreciate y'all. We on the road, getting ready to sign them up, getting ready for another year. And thanks to Delta Health Center and the many other locations that they have given us, city halls, so we can go to those places too. So we're getting ready to roll. Y'all look like y'all ready to roll with us.
Thank you. Have a good day.
I mean, over by my office.
Who's still
I don't do.
Yes, ma'am.
All right, we are finished.
All right. Thank you so much.
All right, you have a good day.
Y'all do the same. Let's get in the road.
Anything else we need to do?
What about y'all's office hours? When will y'all be working? What day?
Office hours. Office hours. We will be here in Mount Bayer from 9 to 2 each Monday. We will be in Indianola from 10 to 2 each Tuesday. Indianola each Tuesday. No, in Leland each Tuesday. Leland, Mississippi. And on Thursday, we will be in Indianola from 10 to 2. And I'll also be sending you a copy of this.
Okay, please do. We would love to post that you guys will be in the Delta, traveling in the Delta.
All right, we'll be all over the Delta. And if need be, we will go to some of the other sites if they refer us there.
Okay, and what's y'all's contact information again? Just in case somebody in the Delta is tuned in and they need someone to assist them.
Henry Knox, 662-588-2490.
Let's make sure we got that right. Can you say it one more time? And we're gonna put it in the chat.
Knox, 662-588-2490.
And we are putting that in the chat. And so just in case anybody from the Delta who may be on Zoom or on social media, that they will have your contact information. Thanks again, Mrs.
Thank you, Mr. Thomas. Thank you so much. Have a good day.
Thank you.
All right.
All right, everybody. Well, we heard from the Delta. So we're going to turn it on. Let's go to the Golden Triangle. The Golden Triangle with Miss Brenda Wilson.
Good morning. Are we on?
Yes, ma'am.
All right. God bless. Good morning, Mississippi. Good morning, America. Welcome to Open Enrollment 2024, where we can acquire health care coverage to help individuals with their needs, for their medical needs, and so forth. I want to say, first of all, thank you, Dr. Miner, Sister Miner, the whole entire Oak Hill Regional Community Development Corporation. I'm here with Carol Jackson. We are here. Hello. We are healthcare navigators. Our base is at Northside Missionary Baptist Church, which is located at 1501 9th Avenue North in Columbus, Mississippi. We will be here Monday to Thursdays from 12 to 4:30, and on Fridays and Saturday by appointment. And we can meet individuals at their local libraries or here in the Columbus area at the library. Now, we are based in Columbus, but we serve the counties of Clay, Knoxville, Lowndes, Ottibbeha, Winston, Choctaw, and Lee. So we provide services to individuals to help them who are underinsured, uninsured, who have lost insurance due to no fault of their own. Perhaps they've aged off of Medicaid or CHIPS, or perhaps they've aged off their family's health care coverage, or perhaps you're an individual looking for a more economical opportunity to receive health care at a reduced or minimal premium cost. Now, one of the things that we do as assisters, as navigators, is we help individuals navigate through the website on healthcare.gov. Not only do we help them navigate that system to identify plans that will be economical and beneficial to your healthcare needs, we also help individuals become aware of other opportunities for healthcare coverage, such as referring them to the federally qualified health centers. In addition to those, we also help individuals understand the different dynamics of their plans, understanding what does a premium mean, what does having cost sharing mean, what does a deductible mean, what does it mean to have an annual out-of-pocket cost, and in general, what does it mean to have the health care coverage, including not only just your health care coverage, but there are other coverages available through the marketplace, such as vision and dental, that goes along with some of the plans, or in some cases, the individual may want to get a standalone dental plan. Now, with that in mind, we also are available at no cost. Keep this in mind, no cost. All of our services are free. We are available to assist you throughout the whole entire year, not just during open enrollment. Now, the reason why we're emphasizing open enrollment is because at this time, during this time period, beginning today, November the 1st, and now we know that because of the holiday, that will extend up until about 5 on January the 17th, individuals can come in and look at the options available and then select a plan depending on your household income and your household occupancy. And this is offered throughout America. We are one of the greatest nations in the world. We are still empowered with the freedom of choice. And I just want to emphasize to you, consumers and citizens of these United States of America, that you have no greater opportunity to do three things. You have the power of choice, you have the power of change, and you have the results of the positive consequences by making such positive choices and enduring with such positive changes. Now, with every choice that we make, we know that it gives us an opportunity to have greater outcomes for our families, for ourselves. For instance, if you have children, and we know we just came out of a pandemic crisis for the past 3 years, and those children were able to keep their Medicaid and CHIPS coverage during that time period. So now we're out of that pandemic experience and we're going into what we call unwinding. Well, some of those children, some of those dependents have aged off Medicare or CHIPS, so Medicaid or CHIPS. So we as navigators and assisters can help them look into the marketplace, help their families, and acquire healthcare coverage. And that not only includes your medical coverage, but as I said earlier, that may include some vision and dental coverage as well. Now, keep in mind that since this is based on your household income and your occupancy, and since the federal government, thank you, Lord, has raised the opportunity for them to expand the financial portion of it, more people will be eligible to get into the marketplace and have greater premium rates reductions. Therefore, I give you an example. We work with a family, can't give out names, but we work with a family, young man in college, he aged off Medicaid and CHIPS. Well, he lives with his grandmother who has her income. She has a part-time job and she receives Social Security and he has a part-time job. Well, after going through the marketplace and checking out everything based on their household income, based on the number of people who occupy in their household, this young man who's in college was able to get a premium for $14.56, which gave him full health care coverage as well as vision and dental coverage. Now, where on earth in this world can you find, I know there are some countries maybe a little bit better than America. I say that very, very, very small, like, but in these United States of America, we have such great opportunities to make the power of choice. So please let us help you. We can help you to understand, what does it mean to have a deductible? What does it mean if I have no deductible? In other words, I can receive my health care, not having to worry about having to reach a certain amount of cost by paying my premium or paying a doctor or a healthcare facility. I can go right in and start receiving my services immediately. And not only that, but you do know that all the marketplace plans provide 10 essential health benefits, preventive care at no cost to you, regardless of your plan. So that's great in itself to know that I'm able to get some preventive services. Women, you're getting those healthcare screenings. Men, you're getting those healthcare screenings. For your children, you're getting those healthcare screenings at no cost to you, regardless of your premium or your plan. So many options, so many choices. And guess what that leads to? Change. Everybody wants change for the better. I'm looking at change not only for you, not only for your family, but I'm looking for a better change for America. You know, some people say we want to make America a better place. Well, to me, the greatest thing we can do for one another is to help empower people to make positive choices, which leads to positive change. And the last of those C's, you know what that is? Positive consequences, positive outcomes. A healthier you, a healthier Mississippian, a healthier American. We are so proud here in the Golden Triangle area as navigators and assisters to offer you an opportunity of a lifetime to help you become a better person, a more productive person, because we know that if you're healthy, you're going to be more productive, you're going to be more alert, you're going to be able to accomplish more things, whatever you may be doing in life at your jobs or various locations. Whatever it is, you'll be able to do it better because you're more healthier. Your body is ready to perform and do the things that it needs to do. So keep in mind, we're here at Northside Missionary Baptist Church is our base, 1501 9th Avenue, North Columbus, Mississippi. And we're here Monday through Thursday from 12 noon to 4:30. However, we can meet you at your location and we can do appointments on Fridays and Saturdays. We're available, really, if you want to call us, you can reach us through our Oak Hill navigation number, which is 662-295-298-3584. Locally, you can call 662-574-2470. Now, I see we have 1 minute left. Y'all know I'm long-winded. I want Miss Carol Jackson, my cohort, to have a few words to say as well.
Hello, everyone. Excited about today. As Miss Brenda Wilson said, and so clearly stated, and so excitedly stated, that we're excited about being here and ready to receive anyone who needs healthcare coverage. The one thing that I love about Miss Brenda Wilson, and the reason why I'm a navigator now, is that she cares about you. This organization cares about you. Because as we know, with healthcare being like it is, and how much it costs just to go to the hospital, to the emergency room, and the fees and how much they're going to charge you, you really need to have insurance. But a lot of people don't know where to go or who to contact or who to see about getting insurance. So as for me, I worked in a restaurant for all those years. So now when people see me, they ask me, what do I do now? And I tell them, well, I didn't know. I'm not making enough money. I'm working at McDonald's and their insurance costs too much. Well, now I'm able to tell them, because of Miss Brenda Wilson caring about me, I'm able to tell them about this organization, Oak Hill, and the quality health plans that we have available to them for their needs, according to their needs and according to their income. They're excited. I've talked to people who have retired out of the school system that, you know, what they were going to do. I introduced them to Ms. Brenda. They're excited. The anxiety of not having coverage can really put a weight on your life. But now they don't have to worry about that. So I'm excited about being a part of an organization that cares about you and your health needs. I'm excited.
Amen. So what does Carol and I have to say to you today? Mississippi, Columbus, America, get covered. Your life is a better life today, and for your family and your other loved ones and your friends, that they have an opportunity for a greater opportunity at life itself, because we're going to be a healthier person. A healthier you is a healthier American. Thank you so much for this opportunity. Thank you, Dr. Miner and the Oak Hill team. Woo! Thank you for everything, giving us an opportunity to serve the people. God bless.
Bye-bye now.
Good morning, good morning, good morning. We are so excited. Today begins the open enrollment for the Affordable Care Act, also known as ACA. One might ask, what is ACA? What is that lady talking about? Well, ACA is the Comprehensive Health Care Reform Law enacted in March 2010. The law makes health insurance available to more people. Open enrollment starts today, November 1st through January 15th, and we are here to assist you. You can contact us at 662-298-3584. And I have with me Ms. Nettie Brazel, Ms. Linda Lee, and also Ms. Candy Shiga. And Ms. Nettie Brazel, she will tell us more about what the ACA, what are the primary goals of the Affordable Care Act.
The law has three primary goals: make affordable health insurance available to more people. The law provides consumers with subsidies that lower costs for households with incomes between 100% and 400% of the federal poverty level. Expand the Medicaid program. And 3, support innovative medical care delivery methods designed to lower the cost of health care generally.
Good morning. I will talk about the programs and service. Under the Affordable Care Act, Health and Human Service administer more than 100 programs across its operating division. Health and Human Service program protect the health of all Americans and provide essential human service, especially for those who are least able to help themselves. To name a few: social services, prevention and wellness, education and training opportunities, complaints and appeals, public health safety, emergency preparedness and response, research, and providers and facilities, just to name a few.
The Affordable Care Act is not limited just to medical. Dental and vision plans are also available. Mental behavioral health is all essential health benefits that are also covered. Health insurance companies will not refuse to cover or charge you more for pre-existing health conditions. And with the new law, 4 out of 5 customers can find a plan for $10 or less per month with assistance.
So don't forget, we are all assisters with Oak Hill Regional RCDC, and we are here to assist each and every one of us. You can contact us again at 662-298-3584. Thank you.
I got a health plan not knowing that I was going to. My plan includes counseling, and it completely changed my life.
I'm not on my parents' health insurance anymore, so I found a plan for just $34 a month.
Signing up was so easy, it only took me 30 minutes to find a plan for $13 a month.
All plans cover doctor visits, prescriptions, emergency care, and more. Healthcare.gov is here for you. Enroll by December 15th.
I'm not on my parents' health insurance anymore, and I work for myself doing a bit of everything, so I found a plan for just $34 a month.
All plans cover doctor visits, prescriptions, emergency care, and more. Healthcare.gov is here for you. Enroll by December 15th.
I got a health plan not knowing that I was going to need it 3 months later. Last year, we had a pretty significant loss in our family, and I knew I needed professional help. Having access to being able to go to a therapist made me better. For $17 a month, my plan includes counseling, and it completely changed my life.
All plans cover doctor visits, prescriptions, emergency care, and more. Healthcare.gov is here for you. Enroll by December 15th.
For $17 a month, my plan includes counseling, and it completely changed my life.
All plans cover doctor visits, prescriptions, emergency care, and more. Healthcare.gov is here for you. Enroll by December 15th.
Good morning, good morning, good morning. We are so excited. Today begins the open enrollment for the Affordable Care Act, also known as ACA. One might ask, what is ACA? What is that lady talking about? Well, ACA is the Comprehensive Health Care Reform Law enacted in March 2010. The law makes health insurance available to more people. Open enrollment starts today, November the 1st through January 15th, and we are here to assist you. You can contact us at 662-298-3584. And I have with me Ms. Nettie Brazel, Ms. Linda Lee, and also Ms. Candy Shiga. And Ms. Nettie Brazel, she will tell us more about what the ACA, what are the primary goals of the Affordable Care Act.
The law has three primary goals. Make affordable health insurance available to more people. The law provides consumers with subsidies that lower costs for households with incomes between 100% and 400% of the federal poverty level. Expand the Medicaid program. And 3, support innovative medical care delivery methods designed to lower the cost of health care generally.
Good morning. I will talk about the programs and service. Under the Affordable Care Act, Health and Human Service administer more than 100 programs across its operating division. Health and Human Service program protect the health of all Americans and provide essential human service, especially for those who are least able to help themselves. To name a few: social services, prevention and wellness, education and training opportunities, complaints and appeals, public health safety, emergency preparedness and response, research, and providers and facilities, just to name a few.
The Affordable Care Act is not limited just to medical. Dental and vision plans are also available. Mental behavior health is all essential health benefits that are also covered. Health insurance companies will not refuse to cover or charge you more for pre-existing health conditions. And with the new law, 4 out of 5 customers can find a plan for $10 or less per month with assistance.
So don't forget, we are all assisters with Oak Hill Regional RCDC, and we are here to assist each and every one of us. You can contact us again at 662-298-3584. Thank you.
Oh, I thought that was me.
All right, let's hear again from another one of our navigators who is located in Holly Springs. Miss Pat Boga.
Good morning. Good morning. I am so excited about the kickoff of the 2024 open enrollment of the Affordable Care Act, Affordable Health Care Insurance. My name is Patricia Boga, and I am a navigator as well as an applications administrator with Oak Hill Regional CDC. And I have been with Oak Hill since February of 2021 and take pleasure in being a part of this organization, my job, and helping people. And of course, we just want to let you know, we don't want you to be stuck without health insurance. And of course, to avoid a gap in the health insurance coverage, you need to act quickly by giving us a call at 662-298-3584 to find a plan that meets your needs or your family's needs and budget. You might say that health insurance is too expensive, but if you happen to get sick and have to go to the doctor or hospital, the out-of-pocket costs will be over the top or be very expensive for you then. And of course, you never know when you might get sick. Okay, so you may end up needing long-term care, and without insurance, the expenses can be overwhelming. Oak Hill Regional CDC offers assistance with Medicaid applications, referrals to federally qualified community health centers, and ACA to help you ease the costs of paying out of pocket, a lot of out of pocket for health care. So there are several avenues available to you. And, a lot of times we look at the word don't as something really bad, but I'm just going to share a few don'ts with you. Don't delay. Okay. Give us a call now. The lines are open at 662-298-3584 to assist you. Don't panic. If you go online yourself looking at ACA plans and think it's no way you can pay for that plan, let us help you with your consent. We can help you with looking over the various health insurance plans to find one that's suitable to your healthcare needs and your pocketbook. Okay. Also, don't be afraid to call us. You may think to yourself, I don't know these people. They may be scammers. Well, you can rest assured that we are only here to help you at no cost, no hidden agendas, and we are not here to scam or hurt you. Make that call or answer the phone if we call you, okay? We have received numerous testimonies from consumers that we have helped get enrolled in health insurance coverage and a plan that has worked for them, and also how they are forever grateful to Get Covered Mississippi navigators for taking the time out and patience with them and getting them covered. One consumer was enrolled in a health insurance plan, and shortly after enrollment was admitted into the hospital for surgery. Now, this was not a planned surgery. This was just an emergency surgery. And he also had to get some physical therapy after this surgery. And of course, had he not reached out to Get Covered Mississippi at that time, he may not have been able to afford and receive the medical care he needed. There are many other testimonies. We want you to be able to be a testimony of how Get Covered Mississippi helped you with ACA health insurance. And of course, save you money or even your life. Okay? Again, we just encourage you to give us a call. That number to call is 662-298-3584. And we are available. Of course, I am in the Holly Springs, Mississippi area. And I can meet you on the phone. I can meet you in person at the local libraries or wherever you need me to meet you, to sit down and talk with you, to help you get covered. Just know that health insurance is very important, and you cannot make it without it. So again, we just encourage you to give us a call, 662-298-3584. And I know I have gone short of my time, but here you are. And that number is ready and waiting. And I did want to share something else. Just because I'm in the Holly Springs, Mississippi area, that does not mean that I cannot assist you. I also work with Sister Brenda Wilson in the Golden Triangle area. And of course, I'm a Medicaid applications administrator, and we assist with enrolling or families applying for Medicaid and CHIP. And of course, if you're not eligible for Medicaid and CHIP, we can refer you to our federally qualified community health centers in our area and in your area. And also, we can look at plans to get you covered with the Affordable Care Act's Affordable Health Care Insurance. And I just want to encourage you to act today.
Security for me, financial security. A positive vibe. As a sole proprietor, it really does come down to me. If I'm not in my chair tutoring, I am losing money. Okay, perfect. If you don't have health care, then you are pretty much one medical emergency away from bankruptcy at all times. And that's, for me, why it's important to use my health care for preventative measures, going in for annual checkups, well woman visits, and things like that. If you go to healthcare.gov, you're going to be able to find a good deal because there's a lot of providers and there's a lot of options. My rate actually has gone down significantly, and I can also every year choose a plan that works for me. Healthcare.gov is peace of mind. Hey Sandra, how are you? Because now I know that no matter what, I can find an affordable plan where I can go to the doctor, take preventative measures, and live my life.
New law, lower prices. More people qualify. Enroll by December 15th to get coverage starting January 1st, 2022. Healthcare.gov.
Hello, my name is Lori Rogers. I am an assistant navigator with Oak Hill Regional CDC, and we are live at Enchanted Days Learning Center Trunk or Treat.
And I'm Alice Jackson. I'm also an assistant navigator for Oak Hill Regional CDC.
ICS Head Start partnered with Oak Hill Regional CDC back in February of 2021, where we both became assisters. And what we do is we assist children and families with Medicaid and CHIP. We begin by gathering information on our families as well as people in the community so we can assist them with recertification for their Medicaid and CHIP. In September of 2021, we all moved from being just assisters to navigators for the marketplace or affordable healthcare health insurance.
I'm excited to announce that open enrollment begins November 1st, and we are ready to serve as many families in our communities as possible. Our goal is to assist the entire family with getting coverage and renewing coverage. We are willing to assist with them with however that we can to make sure that they are covered with medical insurance, health insurance.
So today we want to say Get Covered Mississippi. You can reach us at our headquarters is located in Hernando, Mississippi, 1775 Memphis Street, Hernando, Mississippi. And our phone number is 662-298-3584. Get Covered Mississippi.
Signed into law in March 2010, the Affordable Care Act benefits all Americans, increasing access to quality, affordable health insurance and providing rights and protections that make health coverage more fair and easy to understand. The increased access to insurance options helps narrow geographic, economic, and racial disparities in healthcare coverage. Here are 5 things to know about the Affordable Care Act, also known as the ACA. First, the ACA produced widespread gains in health coverage. Over 20 million people gained insurance, including individuals who can stay on their parents' plan until they're 26. Second, the Affordable Care Act protects Americans with pre-existing conditions like cancer, asthma, or diabetes. Insurance companies can't deny coverage based on a person's medical history or health status. The law also prevents insurers from setting annual or lifetime limits on spending. Third, the ACA focuses on preventive care. It ensures that most insurance plans fully cover the cost for certain recommended preventive services. Colonoscopies, mammograms, well child visits, and flu shots, for example, are provided at no cost to the patient thanks to the ACA. Fourth, the ACA improves health care for women and children. The law prevents insurers from charging women higher premiums than men and requires insurers to cover maternity care, breastfeeding support, birth control, and other services critical to the health of women and children. And Medicaid expanded to include millions of low-income individuals and families who did not previously qualify for coverage. Fifth, the Affordable Care Act is better than ever. Coverage options are increasing and costs are decreasing. President Biden's economic stimulus package, the American Rescue Plan, ensures that many people who enroll in health coverage through healthcare.gov will qualify to save money on plans that meet their needs. Many premiums will decrease on average by $50 per person per month and $85 per policy per month. 4 in 5 consumers will be able to find a plan for $10 or less. For more information or to sign up for affordable coverage, visit healthcare.gov. Produced by the U.S. Department of Health and Human Services.
sense of health benefit. Oh, it's a bath and it's healthy. I almost got this. I can't pull it off. I don't know. Out of network. You tell. No, you tell. No, you tell. You tell. You tell. You tell. You tell. You're not inside of it. No, you tell. No, you tell. You tell. You tell. No. The duck bowl. It's a duck. It's a bowl. Pizza. Maybe it's an alligator. And this is stuck on the boat. Yeah. But you can think. Oh no! I fell. I have no idea. 100. Deal. What's a copay? Pay when you buy things. When you buy things. I like Spider-Man. Pretend surface. Pretend surface. That's baby talk. Because I don't know. Or maybe. You deserve a perfect. No, how much you save it?
After the short intermission, we're going to turn it over to one of our collaborators in Tupelo, Mississippi. Ms. Valerie Long, are you there?
Yes, good morning. I'm here.
All right, you can take it away.
Well, thank you, and good morning to everyone. I am Valerie Long from Tupelo, a navigator. I've been with this organization since 2013, and I've had some invaluable experiences signing people up, giving information about the ACA. A little bit about my organization. We are a collaborative organization with Oak Hill. I work for Catch Kids Incorporated, which is a nonprofit organization. We service 3 counties here in Northeast Mississippi, Tupelo, Lee County, of course, and Chickasaw County and Pontotoc County. Our mission is to offer free medical and dental care for children aged birth to 18 who have barriers to obtaining needed care. So we actually operate freestanding clinics that are manned by local physicians, local pediatricians here in the area, as well as nurse practitioners, one of which I am a nurse practitioner, and we provide the care at no cost. Any prescriptions that we write can be filled at no cost to the children. If they need dental care and do not have Medicaid or dental insurance, then we will send them to the dentist. We partner with local dentists in the area who will provide the care at no cost to the children and at cost to us. We run these clinics, we operate these clinics in both the community-based clinics, and as well as school-based clinics here in the areas. As I said, I've been with Oak Hill since 2013, had the opportunity to sign up individuals who previously had not had insurance, and many of them, so much gratitude, especially when you sign up someone that has not had it and they needed to go to the doctor and saw the doctor, and they call back and say, "Oh, thank you so much. Maybe this is the first time that I've seen the doctor. I've had this problem for a while, and I was able to see the doctor, and we at no cost, and those kinds of things." So it has really been a blessing for so many people, the people that I've signed up in this area, or even people, if I did not have the opportunity to sign them up, to even provide the information about the ACA, and to tell them, to let them know that they are available for, that they can sign up, that they can, and give them the instructions how to sign up and to assist them as needed. So I'm very pleased. I'm so thankful that I have had the opportunity to be a navigator with the ACA. I'm so thankful for the partnership that we have, the collaborative partnership, to be able to provide these services for children in this area, for families in this area as well. So if I would be available here, I will be the person, the navigator that will to assist them for this area. So my telephone number here at Catch Kids is, of course, area code 662-377-2194. Call me if you need information, need instructions, need assistance in any way. I am available and will be most happy to assist you in any way that I can. And to help you with selecting a doctor, any information that's pertinent to you, letting you know the differences between premiums that you pay, the difference between deductibles and all that. I'm available for that, and we'll assist you if you run into problems. If you've tried, to go on the marketplace yourself, which of course is very, very, that you can do that. But if you have problems or run into problems, I'm available. I will try and guide you through that. So I invite you to call me. I'll be here daily, that you can call that number, and I will assist you with any problems that you may have with the ACA. I thank you for this opportunity. I hope if you have not enrolled, that you will enroll, or if you know someone that is not enrolled, that you will tell them about this service and give them this number if they're in this area, Tippah County, Itawamba County, Pontotoc County, as I said, Lee County, Chickasaw County. I'm available to assist them in any way. And the number again is 662-377-2194. For information or assistance with enrolling, anything, I am available. Call me. I'll be happy to assist you in any way. Hopefully you'll have a good day today, and thank you for this opportunity.
I think I need health insurance. Where can I go to get insured? Who can help me get covered? Is it too late? Can someone help me? Come on in. Let's get you covered. Can you help me get insured? What do I need to bring? Can my family get covered? Yes, I can help you. Bring income info, SS number, and household dependent info. Let's set you up. If you need help also, give us a call at 662-983-584.
It's that time again. Open enrollment. We gotta get it moving.
Open enrollment begins today, November the 1st.
Today.
And it goes through January the 15th. This is a very big day for us. Indeed. We are here to help. Oak Hill has certified navigators ready to assist you with getting any kind of coverage that you may need. If you don't qualify for the Affordable Care Act insurance, we can even refer you to a federally qualified community health care center. We just need you to call us so that you can get your coverage or whatever needs met that you need.
Or questions.
Healthcare coverage is so important.
Mentally and physically. We have a great need, especially here in Mississippi.
We want you to contact us, reach out to us, whatever you need. If you sign up for coverage by December 15th, your coverage can start as early as January 1st. If you complete your application for coverage after December 15th, your coverage can start on February 1st, 2024.
Yes, indeed. And if you need that assistance, you can dial 662-298-3584. Again, that's 662-298-3584. Someone is going to answer. We're going to help you. We're going to push through. This is our telethon. We're going to make sure everybody in Mississippi can hear us and get covered because we need this. We have every opportunity that's given to us right here, right now. Let's take advantage of it. Open enrollment. Let's go!
Good morning. My name is Chandra and this here is my son Jamari, and we're here today to tell you guys how important it is to stay up to date on your health and your dental and make sure that you stay coverage on your Medicare and Medicaid, whichever one you need. Healthcare is important for everyone. If you don't have it, then please enroll. Open enrollment coverage starts November the 1st and ends January the 5th. Thank you. 15th. Thank you.
Good morning, my name is Emery and this is my daughter Zuri, and I just want to speak on how it's very important to get coverage, whether it's the Medicaid CHIP or the marketplace coverage. Keeping the coverage is very important, as me being a pregnant mom with twins and having my daughter Zuri. It's very important. It's very important. It helps the peace of mind and knowing that I'm covered through with Medicaid. I don't have to worry about my medical bills or anything. And it's very encouraging with the signs being everywhere with Oakview to remind everyone, Oak Hill, to remind everyone to stay covered and keep coverage. And open enrollment starts November 1st and it ends January 15th.
Thank you.
Thank you.
Go.
Hello, my name is Bionica. I would like to thank Oak Hill, Get Covered Mississippi, and Healthy Kids of Mississippi for helping me obtain medical coverage for me and my children. When I lost my job, they were out in the community in multiple events, and I decided to stop and talk to one, and they got me covered right away. They also helped me with resources in the community and helped me find doctor's offices for me and my children and certain specialists. So thank you, Oak Hill, Get Covered Mississippi, and Mississippi Healthy Kids of Mississippi.
I'm the center director here at the Mary Cathy Head Start Center. I've been with ICS for many years, and I've seen a lot of parents that needed health care coverage. And I'm talking about the open enrollment. We have it November the 1st today up until January the 15th. And if you need this coverage, it's very important. We need you to participate in this open enrollment. If you need any assistance, we need you to contact Oak Hill at 662-298-3584. Open enrollment.
It's that time again. Open enrollment. You gotta get it moving.
Open enrollment begins today, November the 1st. Today, and it goes through January the 15th. This is a very big day for us. Indeed. We are here to help. Oak Hill has certified navigators ready to assist you with getting any kind of coverage that you may need. If you don't qualify for the Affordable Care Act insurance, we can even refer you to a federally qualified community health care center. We just need you to call us so that you can get your coverage or whatever needs met that you need.
Or questions.
Health care coverage is so important.
Mentally and physically. We have a great need, especially here in Mississippi.
We want you to contact us, reach out to us, whatever you need. If you sign up for coverage by December 15th, your coverage can start as early as January 1st. If you complete your application for coverage after December 15th, your coverage can start on February 1st, 2024.
Yes, indeed. And if you need that assistance, you can dial 662-298-3584. Again, that's 662-298-3584. Someone is going to answer. We're going to help you. We're going to push through. This is our telethon. We're going to make sure everybody in Mississippi can hear us and get covered because we need this. We have every opportunity that's given to us right here, right now. Let's take advantage of it. Open enrollment. Let's go! Yeah.
I heard about healthcare.gov on the radio, and with the new law, it was really affordable. It only took me 30 minutes to find a plan for $13 a month.
All plans cover doctor visits, prescriptions, emergency care, and more. Healthcare.gov is here for you. Enroll by December 15th.
Tôi có bảo hiểm healthcare.gov từ nhiều năm rồi. Biết rằng tôi được đại thọ khi đi khám bác sĩ và mua thuốc theo toa là điều quan trọng. Tôi tìm được chương trình bảo hiểm phù hợp cho tôi và quý vị cũng vậy.
What makes up a full life? Being there to lend a hand, being present while feeling our best, because your health really is your wealth. And it starts with health coverage. Find a plan during open enrollment at healthcare.gov today. What makes up a full life? Being there to lend a hand, being present while feeling our best. Because when you sign up for health coverage at healthcare.gov, you invest in your future and the future of your loved ones. Due to the new law, 4 out of 5 customers can find a plan for $10 or less a month with financial help. Live life to the fullest and leave behind a legacy for generations to come. Because your health really is your wealth. Find a plan at healthcare.gov today.
Millions find a low-cost health plan at healthcare.gov so they can enjoy more visits and have less to worry about. Feel like a million and find your plan during open enrollment. Healthcare.gov is here for millions like you. Every year, millions of people find a health plan at healthcare.gov during open enrollment. So they can enjoy more visits, have more meet and greets, and have less to worry about. With the new law, 4 out of 5 customers can find a plan for $10 a month or less with financial help. Feel like a million and find your plan during open enrollment. Healthcare.gov is here for millions like you.
Ghi danh để bảo vệ sức khỏe của quý vị. Ghi danh để bảo vệ sức khỏe gia đình của quý vị. Bảo hiểm sức khỏe hiện đã có thể tìm được bảo hiểm trừ 10 đồng một tháng.
Ladies and gentlemen, distinguished guests, and fellow Mississippians, welcome to a momentous occasion, the 10-year anniversary celebration of Get Covered Mississippi. We are here to commemorate a decade of dedication, passion, and unwavering commitment to promoting health coverage options and wellness across our great state. Get Covered Mississippi is not just an organization. It's a movement that has transformed lives and communities. Through its faith-based coalition, it has raised public awareness about health coverage options available through the Affordable Care Act, Medicaid CHIP, Medicare, and our federally qualified community health centers. The dream of a healthier Mississippi has driven us for a decade, and today we celebrate the milestones we've achieved. From the beginning, our goal has been clear: to see Mississippi emerge as one of the healthiest, most insured states in the nation. Our organization's heart lies in connecting with individuals and families, empowering them to make informed choices for their health coverage. We've championed healthier lifestyles and worked tirelessly to nurture healthier communities, and we are proud of our accomplishments. Our threefold goals have guided us along this journey. First, we rallied grassroots efforts to create healthier communities that benefit everyone. Second, we provided Mississippians with the right resources and information to navigate health coverage options. And third, we have continuously supported our people in making healthier food choices and staying active. Each region of Get Covered Mississippi plays a crucial role in our success, reaching out to individuals across the state. The collaborative spirit among these regions has been the driving force behind our accomplishments. We believe in giving you the confidence to make the best decisions for your health insurance plans. As we celebrate today, let us not forget the work we've done to help those who may not qualify for subsidies or Medicaid. Our collaboration with federally qualified community health centers has ensured that all Mississippians find a medical home, regardless of their circumstances. Referrals to these centers have made a difference in countless lives. This celebration is not just about looking back, it's about looking forward. Our vision for Mississippi's future remains vibrant and clear. As we move ahead, we pledge to continue our outreach, education, and inspiration with the same fervor that has defined us for the past decade. So let's raise our glasses to Get Covered Mississippi's 10 years of impact, advocacy, and service. May our journey ahead be just as fulfilling and transformative. Thank you all for being part of this remarkable occasion. And now, let's enjoy the evening's festivities, celebrate our achievements, and embrace the vision of a healthier Mississippi for all.
Hello, my name is Lori Rogers. I am an assistant navigator with Oak Hill Regional CDC, and we are live at Enchanted Days Learning Center Trunk or Treat.
And I'm Alice Jackson. I'm also an assistant navigator for Oak Hill Regional CDC.
ICS Head Start partnered with Oak Hill Regional CDC back in February of 2021, where we both became assisters. And what we do is we assist children and families with Medicaid and CHIP. We begin by gathering information on our families as well as people in the community so we can assist them with recertification for their Medicaid and CHIP. In September of 2021, we all moved from being just assisters to navigators for the marketplace or affordable healthcare health insurance.
I'm excited to announce that open enrollment begins November 1st, and we are ready to serve as many families in our communities as possible. Our goal is to assist the entire family with getting coverage and renewing coverage. We are willing to assist with them with however that we can to make sure that they are covered with medical insurance, health insurance.
So today we want to say Get Covered Mississippi. You can reach us at our headquarters is located in Hernando, Mississippi, 1775 Memphis Street, Hernando, Mississippi. And our phone number is 662-298-3584. Get Covered Mississippi.
It's that time again. Open enrollment. You gotta get it moving.
Open enrollment begins today, November the 1st. Today, and it goes through January the 15th. This is a very big day for us. Indeed. We are here to help. Oak Hill has certified navigators ready to assist you with getting any kind of coverage that you may need. If you don't qualify for the Affordable Care Act insurance, we can even refer you to a federally qualified community health care center. We just need you to call us so that you can get your coverage or whatever needs met that you need.
Or questions.
Healthcare coverage is so important.
Mentally and physically. We have a great need, especially here in Mississippi.
We want you to contact us, reach out to us, whatever you need. If you sign up for coverage by December 15th, your coverage can start as early as January the 1st. If you complete your application for coverage after December 15th, your coverage can start on February the 1st, 2024.
Yes, indeed. And if you need that assistance, you can dial 662-298-3584. Again, that's 662-298-3584. Someone is going to answer. We're going to help you. We're going to push through. This is our telethon. We're going to make sure everybody in Mississippi can hear us and get covered because we need this. We have every opportunity that's given to us right here, right now. Let's take advantage of it. Open enrollment. Let's go!
Good morning. My name is Chandra, and this here is my son Jamari, and we're here today to tell you guys how important it is to stay up to date on your health and your dental, and make sure that you stay covered on your Medicare and Medicaid, whichever one you need. Healthcare is important for everyone. If you don't have it, then please enroll. Open enrollment coverage starts November the 1st and ends January the 15th. Thank you.
Good morning, my name is Emery and this is my daughter Zuri, and I just want to speak on how it's very important to get coverage, whether it's the Medicaid chip or the marketplace coverage. Keeping the coverage is very important, as me being a pregnant mom with twins and having my daughter Zuri. It's very important. It's very important. It helps the peace of mind and make knowing that I'm covered through with Medicaid. I don't have to worry about my medical bills or anything. And it's very encouraging with the signs being everywhere with Oakview to remind everyone, Oak Hill, to remind everyone to stay covered and keep coverage. And open enrollment starts November 1st and it ends January 15th.
Thank you.
Yeah. Hello, my name is Bionica. I would like to thank Oak Hill, Get Covered Mississippi, and Healthy Kids of Mississippi for helping me obtain medical coverage for me and my children. When I lost my job, they were out in the community in multiple events, and I decided to stop and talk to one, and they got me covered right away. They also helped me with resources in the community and helped me find doctor's offices. for me and my children and certain specialists. So thank you, Oak Hill, Get Covered Mississippi, and Mississippi Healthy Kids of Mississippi.
I'm the center director here at the Mary Cathy Head Start Center. I've been with ICS for many years, and I've seen a lot of parents that needed health care coverage. And I'm talking about the open enrollment. We have been November the 1st today up until January the 15th. And if you need this coverage, it's very important. We need you to participate in this open enrollment. If you need any assistance, we need you to contact Oak Hill at 662-298-3584. Open enrollment.
Good morning, good morning, good morning. We are so excited. Today begins the open enrollment for the Affordable Care Act, also known as ACA. One might ask, what is ACA? What is that lady talking about? Well, ACA is the Comprehensive Health Care Reform Law enacted in March 2010. The law makes health insurance available to more people. Open enrollment starts today, November the 1st through January 15th, and we are here to assist you. You can contact us at 662-298-3584. And I have with me Ms. Nettie Brazel, Ms. Linda Lee, and also Ms. Candy Shiga. And Ms. Nettie Brazel, she will tell us more about what the ACA, what are the primary goals of the Affordable Care Act.
The law has three primary goals. Make affordable health insurance available to more people. The law provides consumers with subsidies that lower costs for households with incomes between 100% and 400% of the federal poverty level. Expand the Medicaid program. And 3, support innovative medical care delivery methods designed to lower the cost of health care generally.
Good morning. I will talk about the programs and service. Under the Affordable Care Act, Health and Human Service administer more than 100 programs across its operating division. Health and Human Service program protect the health of all Americans and provide essential human service, especially for those who are least able to help themselves. To name a few: social services, prevention and wellness, education and training opportunities, complaints and appeals, public health safety, emergency preparedness and response, research, and providers and facilities, just to name a few.
The Affordable Care Act is not limited just to medical. Dental and vision plans are also available. Mental behavior health is all essential health benefits that are also covered. Health insurance companies will not refuse to cover or charge you more for pre-existing health conditions. And with the new law, 4 out of 5 customers can find a plan for $10 or less per month with assistance.
So don't forget, we are all sisters with Oak Hill Regional RCDC, and we are here to assist each and every one of us. You can contact us again at 662-298-3584. Thank you.
And I'm back again. Now we're going to turn it over to an application administrator, Ms. Mary Fenner.
Good morning, everyone. My name is Mary Fenner, and I'm an application administrator with Get Covered Mississippi for Oak Hill Regional Development Community Corporation. I'm here to talk about open enrollment for the Affordable Care Act. And I want to talk first about, let you know what Get Covered Mississippi is. Get Covered Mississippi is a statewide faith-based coalition focused on raising public awareness and engaging consumers about health coverage options available through the Affordable Care Act. Also, the Affordable Care Act covers 9 essential benefits. Ambulatory patient service, that's outpatient care that you can get without being admitted to a hospital. Emergency services, hospitalization, maternity and newborn care, mental health, prescription drugs, rehabilitative and habilitative services, laboratory services, preventive and wellness services, also pediatric services. So that's 10 essential benefits that the Affordable Care Act covers, and that's the thing that we need in order to take care of ourselves. Also, there's a coverage to care, and that's part of the Affordable Care Act work as well. You start with put your health first. It's important that you put your health first. And then you understand your health coverage. So by signing up with the Affordable Care Act, that will help you to understand your health coverage. There's always somebody that you can talk to if you have questions about your health coverage. Another thing is know where to go for care. There's someone to help you to decide where you need to go for care or what doctor's office takes the type of benefits that you may have. Also, you need to find a provider. And there are services that the Affordable Care Act has to help you to find a provider. You have to make an appointment. Be prepared for your visits. That's what any questions that you may have for your doctors. Also, decide if that provider is the right one for you, because if that's not the right one, you always have a choice to pick one that will better help you. And then next steps after your appointment, make sure you follow up with the doctors, all the instructions they have given you in order to make a better you. And that's what the Affordable Care Act is all about. It's about helping people get health coverage at a reasonable price. And also to make sure it's important that everyone has health coverage, because if you depend on hospitals and emergency rooms and ambulances to take you to the hospital, those costs could be skyrocketed, and you will get billed for those. So sign up for the Affordable Care Act. Call our office 662-298-3584 and talk with a navigator, or either come into our office. We're located in Hernando, 1775 Memphis Drive. Come in and someone will be here to assist you with signing you up for insurance through the Affordable Care Act. Have a good day. I didn't do 10 minutes.
Thanks for that, Ms. Fenner. Now we're going to turn it over to another navigator who I believe is in the Hollis Springs area, Miss Sharita Smith. Is Sharita Smith, are you with us?
Good morning, Duke. I am. Can you hear me?
Yes, I can hear you. Go right
Okay,
ahead.
awesome. My name is Sharita Smith. I'm also an assistant navigator for the Oak Hill Regional CDC, Team North Mississippi Head Start. I serve Region 6 in the Marshall County area. I've been with Oak Hill for 2 years now. I started in 2021. Open enrollment does start today. A little bit about the ACA is the Affordable Care Act. You can have pre-existing conditions. You can pick your plan based on your cost to you and your doctor to make sure you know your doctor is in that coverage area of the insurance that you do choose. If you enroll by December 15th, you will start off the new year with new health insurance. So I advise anyone, actually today is the kickoff, which is awesome. But please, if you can, enroll by December 15th. At least you will be able to start January 1st with new health coverage. New you, new year, everything will be great. And my personal testimony with myself is my daughter ended up losing health coverage last year when she turned 19. And I was kind of optimistic on, signing her up and how much it was going to cost, because health insurance can be costly. But I can guarantee you with the ACA, please go to healthcare.gov and you will not go wrong. I went and searched for my daughter. In a couple of hours, my daughter had health coverage that I could afford. I was thinking about doing her like my mom did me. You know, once you lose coverage, you get grown, get your job, go find your own health care. But I did not do that. I had to find her health coverage with everything that's going on in the world, the sickness, the illness, the COVID, the flu. I had to get her covered. So that was one thing for me. That's my personal testimony, and she's still with ACA today. She loves it. I loves it. We have had no hiccups whatsoever. We don't had emergency room visits and everything. We have not had not one problem using her health insurance. So with that saying, please do not delay. There are a lot of options out there. I myself, just like I said, was skeptical about it. Because insurance can be expensive, but not through the ACA. And just like they said, if you doesn't qualify for the ACA, there are other programs out there with the doctors and stuff that you can go through with, like the sliding fee, which goes by also your income. Please don't hesitate to give us a call. We can talk on the phone. We can meet in public. I can meet you at a restaurant or the library, anywhere. We'll definitely try to get you and your family some health insurance. Just with the preventive and wellness services itself of health insurance is great. At least you'll know everything is okay. Being tested to make sure you're not pre-diabetic or hypertension or anything like that, because I do mine every year. Every year. It's just good to know that you are in good health. Our head office is located in Hernando, Mississippi. However, you can call or text with any and all questions you may have. The number is 662-298-3584. Also, you can text at 662-689-9712. Thank you for this opportunity, and I cannot wait to hear from you, and I hope you all have a wonderful and great day. Thank you.
Every year, millions of people find a health plan at healthcare.gov during open enrollment, so they can enjoy more visits, have more meet and greets, and have less to worry about. With the new law, 4 out of 5 customers can find a plan for $10 a month or less with financial help. Feel like a million and find your plan during open enrollment. Healthcare.gov is here for millions like you.
Ghi danh để bảo vệ sức khỏe của quý vị, ghi danh để bảo vệ sức khỏe gia đình của quý vị. Bảo hiểm sức khỏe hiện đã có giá phải chăng hơn nhờ vào luật mới. 4 trong 5 khách hàng có thể tìm được bảo hiểm chỉ 10 đồng một tháng hoặc ít hơn. Gọi 1-800-318-2596 ngay hôm nay. 登記投保保障健康，登記投保保障家人嘅健康。而家新嘅法律令健康保險更容易負擔，每客戶當中有4位可以揾到每個月低於10蚊美金嘅健康保險計劃。打電話1800-318-2596。報名投保保障健康，報名投保保障家人健康。新的法律讓健保現在更易負擔，每5位客戶就有4位能得到每月低於10美元的健保計劃。請致電1800-318-2596。
건강을 지키기 위해 가입하세요. 가족의 건강을 지키기 위해 가입하세요. 새로운 법률로 이제 건강보험료가 더 낮아집니다. 5명 중 4명의 고객이 월 10불 이하의 플랜을 찾을 수 있습니다. 오늘 1800-318-2596으로 전화하세요.
Mag-sign up para maprotektahan ang iyong kalusugan. Mag-sign up para maprotektahan ang kalusugan ng iyong pamilya. Mas affordable na ngayon ang healthcare insurance ayon sa bagong batas. 4 sa 5 customers sa makakakuha ng plan na mas mura pa sa $10 kada buwan. Tumawag sa 1-800-318-2596 ngayon.
अपनी सेहत के लिए साइन अप कीजिए अपने परिवार की सेहत के लिए। एक नए कानून के कारण अब और ज्यादा लोग हेल्थ इंश्योरेंस अफोर्ड कर सकते हैं। 5 में से 4 कस्टमर्स को मिलता है एक प्लान जो है $10 या कम पर मंथ। Call 1-800-318-2596 today.
Trabajo por mi cuenta y encontré un plan de salud por $7 al mes que me da gran tranquilidad.
Mi trabajo no me cubre el seguro, pero encontré un plan por $0 al mes. Encontramos un plan de salud familiar por $14 al mes.
Sí, y la inscripción fue muy sencilla y rápida.
En cuidadodesalud.gov, 4 de cada 5 consumidores encuentran un plan de salud por $10 o menos al mes con ayuda financiera. Encuentra el tuyo hoy.
Encontré un plan de salud para toda mi familia por $0 al mes. Es un alivio.
En cuidadodesalud.gov, 4 de cada 5 consumidores encuentran un plan de salud por $10 o menos al mes con ayuda financiera. Encuentra el tuyo hoy.
Encontramos un plan de salud familiar por $14 al mes.
Y la inscripción fue muy sencilla y rápida.
Con la nueva ley, más consumidores califican para ayuda financiera. Encuentra un plan de salud en cuidadodesalud.gov.
A sense of health benefit. Oh, it's a bath that is healthy. Almost got this. I can't pull it off. I don't know. Out of network. You tell. No, you don't. You tell. You're not inside of it. You tell. The duck. It's a duck. It's a bone. Pizza. Maybe it's an alligator. look on the boat. Yeah. But you can take. Oh no! I fell. I have no idea. 100. Deal. What's a copay? Pay when you buy things. When you buy things. I like Spider-Man. Conservative. That's baby talk. Because I don't know. Or maybe. You deserve a perfect. No, how much you save it?
All right, good evening, everyone. Again, my name is Clarence Campbell, and I am a marketplace navigator with Oak Hill Regional Community Development Corporation, and I'm also the education coordinator for the same organization. And what I'd like to talk with you about tonight is it's a topic called Marketplace 101, and it's going to be an overview of obtaining and making the best of utilizing insurance that you can obtain through the marketplace, also known as Obamacare. I think this is particularly important right now because since the public health emergency ended in April, we have a number of people that are going through the redetermination process and finding themselves that they're no longer eligible for Medicaid. And so we have a number of people that need to get some other type of coverage. And the coverage, one option coverage is going to be through the marketplace. And so I'd like to talk a little bit about exactly what the marketplace is, how to obtain coverage from the marketplace, the different types of coverage that's available, and how you can get help in obtaining this coverage. All right, and so this is called Marketplace 101 again, and it's using the marketplace to find health options that meet consumers' needs and fit their budgets. And as Duke mentioned earlier in this broadcast, open enrollment's right around the corner. Open enrollment for marketplace coverage starts November 1st. if you enroll before December 15th, that means your coverage will begin on January 1st of 2024. It still is open for enrollment until January 15th. And as long as you enroll before January 15th of 2024, you'll have coverage available on February 1st of 2024. And so again, objectives: understand the health insurance marketplace, define who might be eligible for marketplace coverage and how much to apply, discuss options for consumers, describe the enrollment process, provide information about other health coverage options, and just talk about resources and assistance. Okay, so overview of the health insurance marketplace. What is the marketplace operation in the marketplace, and how consumers use the marketplace? Okay, the health insurance marketplace provides health plan shopping and enrollment services for individuals and families. This is called the individual market. And then for employees of small businesses, there's a small business health operations program, which is known as SHOP. The marketplace will determine eligibility for coverage in marketplace plans. It will determine the eligibility for advanced payments of the premium tax credits, APTC, towards monthly premiums, cost sharing reduction, CSRs, to lower what consumers pay for out-of-pocket costs like deductibles, co-payments, and co-insurance, and then eligibility for Medicaid and the Children's Health Insurance Program, CHIP. And I'm just going to go right back up to where it says advanced premium tax credits. Advanced premium tax credits are what makes the Affordable Care Act coverage affordable. This is what reduces the amount of your monthly payments. And so this is extremely important in being able to qualify for these tax credits so that you can obtain this coverage at an affordable cost. Okay, operations of marketplaces. A marketplace can be operated by a state-based marketplace, SBM, or the federal government, federally facilitated marketplace, also called FFM. Within our area here in the Mid-South, Mississippi, Tennessee, Arkansas, Alabama, and Louisiana all have a federally facilitated marketplace. Some of the other states a little away from us, for example, Kentucky has a state-based marketplace, and so it operates just a little bit different. But in a federally facilitated marketplace, the federal government manages all the marketplace functions. How consumers use the marketplace. Consumers can use the marketplace to find and apply for health and dental coverage that fits their budget and their specific needs. To find coverage in the FFM states, you can find your coverage through healthcare.gov. Healthcare.gov is a federally operated website that governs, that manages the Affordable Care Act coverage. Applying for coverage. You can apply for coverage by either going online. You can go online through healthcare.gov. You can call a number that we'll bring up later. You can mail off a paper application, or you may be able to get assistance through a marketplace enrollment assister, agent, or broker in the area. And we're going to really focus on the marketplace enrollment assisters. We call them navigators. And as you go through a marketplace application, then as you're completing this application and submitting it, this can also help you determine whether or not you or other members of your family would be eligible for Medicaid or CHIP. I'm gonna go back to the federal website, which is healthcare.gov. Make sure that anytime you're online and you're looking for healthcare coverage, that you do go to healthcare.gov and not healthcare.com or .org or anything else, because that'll get you into commercial sites which are not actually a part of the marketplace. All right, who's eligible for coverage through the marketplace? To be eligible for coverage through a marketplace, individuals and households must live in the United States in a state serviced by the marketplace where they're applying. And so if you want to apply here in Mississippi, that means you have to be a Mississippi resident. You have to have a Mississippi mailing address. You also have to be a United States citizen, a U.S. national, or lawfully present immigrant for the entire time that you plan to have coverage. And then you cannot be incarcerated unless you're pending disposition of the charges. Okay, so what are marketplace plans? Marketplace plans are plans that are going to provide quality health coverage. They cover a minimum set of comprehensive benefits, which are called essential health benefits, EHBs. Marketplace plans also establish limits on cost sharing, such as deductibles, co-payments, and out-of-pocket maximums. And one of the things that's really special, really nice about marketplace plans is they cannot deny coverage due to existing medical conditions that you have. And so when you apply, if you are deemed to be eligible to purchase coverage, then whatever existing condition that you might have and being treated for, taking medications for, this plan will have to pay for it. All right, so once you go through the application process and you're deemed that you're eligible to purchase a plan, you're going to find that there's 4 categories of health plans, and these are called the metal levels. They go from bronze up to silver, and what determines the level is the amount of coverage or cost that the consumer is going to pay versus what the health plan pays, and they call that the actually variable value, the AV. So a bronze plan means that the plan is going to pay 60%, the consumer will pay 40% on average. Silver plans, the plan pays 70%, the consumer pays 30% on average. Gold plans, the plan pays 80%, consumers pay 20%, and then a platinum level plan, it's a health plan where the plan pays 90% of the cost and the consumers only have to pay 10%. Now, of course, in order to get a plan that in order to get coverage where the plan is going to pay a higher percentage, that generally means that you're going to have higher premiums. Yeah, you pay higher premiums for the plan to pay a higher amount. Now, what I've done is I've brought up some sample plans. I've got a sample silver plan, and I have a sample bronze plan that'll follow this. And this particular plan was generated for an older individual. By older, I mean they're probably in their 40s and their income is probably around $45,000 or so a year. I don't have the specifics, but factors such as the age of the enrollee and their income help determine what your monthly premium is going to be. It also determines the amount of tax credit that you're going to have available to you. So if you look at this plan, it says it's your monthly premium, the amount that you would pay is $101.68. And this includes a $339.07 tax credit, which is paid on your behalf. And what this is doing is this is reducing a $440.75 monthly premium down to $101. So it's reducing it more than 75%. Yes, I know $101 could be a lot of money for you, but it's certainly a lot less than $440. And it's also a lot less than what you would have to pay for procedures if you don't have any coverage. This particular plan, and I'll give you a disclaimer, it's by Ambetter from Magnolia Health. I do not represent any particular insurance companies. This just happens to be one that seems to pop up as being one that a lot of consumers are eligible for. But this particular plan, you can see that it has a $0 deductible. Maximum out of pocket would be $1,200 for the year. And then your co-insurance, co-payment amounts are, say, 30% for emergency care, no charge for generic drugs, no charge to see a primary care doctor. And if you have to see a specialist, your cost would be $5. This plan also covers adult dental. You see the green check here. It also provides vision. And this plan, I searched in Marshall County, and this particular individual is using one of our federally qualified health centers, the Bahalia Family Health Center, as their primary care doctor. And so this is just typical of a silver plan that an older individual might get that has a slightly higher income. Now, a plan that's, I have to again remind you, so this plan is, by being a silver plan, it's going to pay 70% of the cost, and you, the consumer, the individual, you'll be responsible for 30% of the cost for typical procedures. Okay, now this is a sample bronze plan. Okay, whereas the silver plan paid 70%, the bronze plan only pays 60%. And it does have a slightly lower premium. Rather than $101, this one is $79. But you can see with this particular bronze plan, it's got a deductible of $8,300 a year. Your out-of-pocket maximum is $8,700 a year. And the cost for co-insurance for emergency room is 50% rather than 30%. Generic drugs are $27 rather than, I think it was $5 or $10. Primary care doctors, $40. And a specialist is $90. Okay, so I'm showing you this to illustrate that silver plans, if you qualify for them, have greater cost savings reductions, which means that you can get much better service for a much lower cost. Now, these two plans, I've compared them with younger individuals that have a lower income, say income around $20,000 or something like that, or less a year. People are just getting starting out. And so with the younger people, the monthly premium for this plan would be $0. maybe. And then for the silver plan, you might have to pay $25. Again, we're talking about coverage for a younger individual that, let's say they might work at Walmart or another business where they make a reasonable income, but they don't have health coverage available for them there. But this is a means of them being able to get excellent coverage for a cost that's not very expensive. Okay, the essential health benefits. All marketplace plans have to cover 10 essential benefits, the 10 EHB categories. And these categories are, and I'll read them to you, they're ambulatory patient services like doctor and clinic visits, emergency services like ambulance, first aid and rescue squad, hospitalization, maternity and newborn care, mental health and substance use disorder services, including behavioral health treatment, prescription drugs, rehabilitative and habilitative services and devices like therapy sessions, wheelchairs and oxygen, laboratory services, preventive and wellness services and chronic disease management like blood pressure screening, immunizations, pediatric services, including dental and vision care. The pediatric services are if you have a child that's, I think, well, under the age of, oh gosh, we'll just say under the age of 12, maybe, then dental and vision are going to be paid for these children. And that's if they don't have coverage through Medicaid or CHIP. Okay, and so as we look at these, the first 8 categories here, these are services that fall into having coinsurance and also having to have paid down your deductible before the plan pays the actual, well, let's just say the AV amount of 60%, 70%, 80%, 90%, depending on which metal plan you have. And then you also have your co-payments that will be listed in the plan information that you get. But something else that it's very important is that all marketplace health plans and many other plans must cover an extensive list of preventive services without charging you a co-payment or co-insurance. This is true even if you haven't met your yearly deductible. So there's a whole range of services that are going to be available to you if you enroll in a plan that you'll be eligible to receive without having to pay down maybe a large copay, and you won't be charged co-insurance for this. And I think this is important to realize is that sometimes because of personal finances, you may not be able to afford a silver plan, but you can find a bronze plan for $20 a month or something like that. And so once you're in this bronze plan, once you have this coverage, then you are eligible to go see a doctor and have the office call co-payment reduced. And then you're also going to be eligible for these different preventive benefits, which I'll show you starting with this slide. Now, it's a lot of information on it, but there's at least, I think, about 18 different categories of preventive care benefits for adults. And I'm going to read through them and bore you with it, but it's like abdominal aortic aneurysm, one-time screening for men, alcohol misuse screening and counseling, aspirin to prevent cardiovascular disease and colorectal cancer for adults, blood pressure screening, cholesterol screening, colorectal cancer screening for adults 45 to 75, depression screening, diabetes type 2 screening for adults 40 to 70. Oops. Sorry. Diet counseling for adults at higher risk for chronic disease, fall prevention with exercise and physical therapy, and vitamin D use for adults 65 or older. Hepatitis B screening for people at high risk. Hepatitis C screening for adults 18 to 79. HIV screening for everyone 15 to 65 and at other ages at increased risk. Then there's PrEP, pre-exposure prophylaxis, HIV prevention medication. Immunization for adults at the recommended doses, recommended ages, and recommended populations. And so right now there's a big push for certainly getting your flu shots. There's the latest coronavirus booster that's out. There's the RSV vaccination that's out. There's shingles. There's pneumonia vaccinations that are out and available for people that have a high risk or just want to try to protect themselves. Okay, so being enrolled in a plan means that you have access to these vaccinations at no cost. Then there's lung cancer screening, obesity screening and counseling, sexual transmitted infection, STI prevention counseling for adults at higher risk, statin prevention medication for adults, statin managing your cholesterol, syphilis screening for adults at high risk, tobacco use screening for all adults, and cessation inhibitions for tobacco users, and then tuberculosis screening for certain adults without symptoms at high risk. And so all these things on this page, and again, the previous page, are covered at no cost to you. All right, so I mentioned before that it's what makes the Affordable Care Act coverage affordable is the premium tax credits. And the way these tax credits are determined is if your income falls between 100% and 400% of federal poverty level, you may qualify for this premium tax credit. Okay, and so this is between 100% and 400% at your particular family size level. Now, these premium tax credits are only available to consumers who enroll in an individual marketplace plan through the marketplace. If you're eligible for them, you can use all of them, some of them or none of them on a monthly basis. If a consumer is ineligible for Medicaid based on immigration status, they may be eligible to enroll in the marketplace plan with the premium tax credit, even if they're under 100% of the federal poverty level, unless otherwise eligible. All right, so this chart, this table right here, included to try to illustrate to you what I mean by eligibility for tax credits and to purchase a plan. And I need to emphasize too is that coverage through the Affordable Care Act, the marketplace, is not a free program. It's not meant to replace Medicaid, Medicare, TRICARE, or anything else like this, but it's another option. It's also an option to people that don't have affordable coverage through their employer, no coverage available through their employer, or if maybe you're self-employed. And so the way your income fits in here is, let's say if you're a single individual and you want to obtain coverage, you have to make at least $14,580 next year. And this figures out to about 12, let's say less, around $1,300 a month. You need to make at least that amount in order to qualify for the tax credits, which will reduce your premiums to probably virtually nothing. And this runs all the way up to $58,000 for a family size of one. So as your family size increases, then you have to have a higher income in order to qualify. And then it also means that you'll continue to qualify with higher incomes. And so the amount of tax credits that you have available to you are going to be based off of your estimated income as well as your family size. Okay, there's also something called cost savings reduction, CSRs. Some consumers who apply for coverage through the marketplace and qualify for premium tax credits may also qualify for extra savings called cost saving reduction, CSRs. And to be eligible for CSRs based off income, you have to have household income between 100 and 200% of the federal poverty level, be eligible for premium tax credits, and enroll in a silver plan through the marketplace. So I'm gonna go back a slide and let's see, between 100% and 250%. So if you look at this chart right here, so let's look at the single member of a household. So to really qualify for the cost savings reductions, 150% would be $21,870. 250% would be $36,450. So if a person's income fell within that range, they would qualify for the most beneficial cost savings reductions. All right, so how do we enroll in marketplace coverage? One way is to call the Marketplace Call Center. You can also go online at the healthcare.gov site that I talked about. Then there's in-person help that's available, and that's where Oak Hill Regional Community Development Corporation and Get Covered Mississippi comes into play. We'll talk about that in just a second. When can you enroll? I'll go through this again. Eligible consumers can enroll in or change your marketplace plans during the open enrollment period, or during a special enrollment period. For federally facilitated marketplaces, which is what Mississippi is, open enrollment period again begins November 1st and runs through January 15th of 2024. And again, if you want to have coverage beginning January 1st, you have to be enrolled in the plan and have paid your first month's premium by December 15th.
All right, everybody, it has come to our break time. We will convene back here at 1:30 p.m. We will stop the live stream, but we will be on Zoom until the entire break, showcasing the flyer, the telethon, and more information about the ACA. So everybody take a moment to stretch, and we will see you guys back at 1:30.